Ms. Bennett is a 64-year-old female who came in to see her primary care physician with the chief complaints of exacerbations and insomnia. She was screened using the audit score and she scored somewhere in zone 2, which places her in the risky category. Hi, Ms. Bennett. Thank you for coming in to see me today.
Thank you.
I am Dr. Sanders. I am the behavioral health clinician here on staff. I work with Dr. Lee, and as he stated in his warm handoff, he thought it was a great idea for you to come in and speak with me. So thank you for taking time to come in and talk with me today.
You're welcome.
I see that you completed the audit, the alcohol use disorders independent screening, and you screened somewhere in zone 2, which places you in the risky category. Thank you, first of all, for completing the screening. Um, and I wanted to know if it was okay if we take a couple of minutes and just discuss your screening. Is that okay?
Yes.
Okay. So I noticed that you said that you drink about 2 to 3 times a week. And when you are drinking, you may drink about 3 to 4 times. Is that correct?
Yes.
Okay. So on occasions when you are drinking, you may exceed 7 drinks per week. And that is what puts me in concern because have you ever thought about the fact that your drinking may contribute to the exacerbations, which actually make your COPD act up and may actually be causing some of the insomnia?
It could be because when I drink, I smoke a lot.
Okay. So, tell me about what a typical day would look like when you may experience the exacerbations and insomnia.
Having a hard day at work, dealing with family issues. It's a multiple of things, really.
Okay, so having a hard day of work. So when you have a hard day of work, what are you doing that would contribute to you smoking more?
Um, that's kind of hard to say. Uh, Only because I guess the time frame that I have when I'm at work. So it's like my smoking really comes after work. But being the fact that I'm on a time restraint, like 30 minutes for lunch and 15-minute breaks, uh, usually my 15-minute breaks my smoke can take up to 15 minutes. Uh, Within the 30-minute lunch, I try not to exceed one, but that depends upon whether or not I've had any cigarettes. Say, for instance, today I didn't have none. I don't even have a pack. But once I buy that pack, I smoke about two or three, one after another.
Okay, so I noticed that you said you may smoke more after work. So tell me about what you're doing after work that will put you in the situation where you're smoking more.
Uh, Sometimes I go to the casino. Not often, but I'll go to the casino, and um, I think that's when I really overdo it with my drinking.
Okay, so your behaviors occur more, they increase when you're at the casino. So the casino kind of triggers your behaviors to smoke and drink more.
Yeah, even though we can't smoke inside the casino no more. I tell you one thing, I'm gonna go to my car and I'm gonna smoke about two or three before I go back.
Okay, so when would you say you were less likely to experience the exacerbations that's brought on by your smoking?
Meaning,
Meaning, when are you less likely to have exacerbations?
mm, that's kind of hard to answer because I never know.
Because I see you say that you experience an insomnia also. So is the insomnia contributed to the coughing that You stated in the notes you said that you cough more in the evening time. Is that correct?
when I go to bed.
Gotcha. So I'm just thinking about the whole picture, and it seems as if you have risky behaviors, which put you in a potential to for your illness to decline. You are smoking more when you're at the casino, and you're having exacerbations at night, which is causing insomnia. So basically, I want you to look at this chart. It tells us that 12 ounces of beer or 4.5 ounces of wine or 1.5 ounces of liquor is a standard drink. And you're actually taking in 3 to 4 drinks at times. Sometimes you exceed 7 drinks per week. And if you look at the scale for a female, you would have no more than 3 drinks a day and no more than 7 drinks a week. So that's why you're actually in that risky category. You understand?
Okay.
So basically, if we were thinking about your readiness to make changes, we would say on a scale of 0 to 10, with 0 meaning not at all and 10 meaning very important. Where would you say you will fall on this scale for being ready to change?
5.
A 5. Okay, so you said a 5, which puts you somewhere in the middle. Can you tell me why you didn't say a 4 or even a 6?
Um, because there's a lot of things I try and do on my own,
Okay.
and sometimes I succeed, and sometimes I don't. Um, I know that my habits that I have are not good habits. Um, because I do have health issues, and what I'm doing as far as drinking and smoking is not helping them.
Okay. Well, that middle, that 5 puts you in the somewhat ready to change category. And what I understand is sometime when you are making changes, it's good to set goals, which we like to set specific, measurable, attainable, reliable goals within a time frame. What would you say you would be able to do within the next, I believe your appointment to come in and see your primary care doctor is in the next 4 weeks. So within the next 4 weeks, what would you say you would be able to do in order to limit your alcohol intake?
Um, the best thing for me is not to be around it,
Okay.
not to buy it.
And remember, when we say SMART goals, we want to make sure that we understand that we want to make goals that you're able to achieve. So understanding that the goal is not to state that you shouldn't go to the casino, which is a trigger, or you shouldn't drink, or you shouldn't smoke. We want to set goals to kind of in time scale back. So instead of just saying, okay, I shouldn't do it, what would you think would be a realistic goal in order to do less? Currently you're drinking 3 to 4 drinks. So would you say a small goal may be to drink,
Not to drink at all, really.
right? That would be the ultimate goal. But let's just say we're not at that point yet. So what would you say you will be able to realistically do in order to make a change?
Um, environment.
Okay.
Um, I have to change my environment, and like they say, oftentimes, in order to make a change, you have to disassociate yourself from that area that caused you to do what you do.
Right. And even if you do, because they do cause triggers, if you do find that you find yourself enjoying your leisure time at the casino, instead of having 3 to 4 drinks, maybe you can look at taking in, after a drink, you may drink a bottle of water. Or maybe after you drink 2 drinks, you may take in a bottle of water. Sometimes that may help you to be cognizant about your alcohol intake, and it also might limit the amount of drinks that you have. If that is that something that you think you can do?
I've done it before.
Okay.
When even if I have one drink, I'll say, well, I'm not gonna drink anymore. I may substitute the drinking with a cup of coffee or a soda.
Okay. Yeah. And basically I want to make sure that you understand that caffeine also has its side effects, as well as um sodas. So, but sensible changes is the goal here. So, as I said, maybe instead of the caffeine, maybe we can look at water. Or maybe instead of a cold drink, if you want to take your coffee in, we can substitute one of those with water. Is that something that you think is doable?
It could be.
Okay, sounds great. So let's just recap what we talked about today. We talked about your diagnosis. We talked about the fact that you are currently in the risky category. We spoke about the triggers, which can be after hard days of work and when you're at the casino. We talked about some lifestyle changes, which would include your possibly taking in less than the typical 3 to 4 drinks. Maybe after 2 drinks, you may substitute with a bottle of water. Um, and you also stated that another goal that you have is to change your environment. Is that correct?
Yes.
Okay, all of that sounds great. And remember that my goal is to work with the primary care doctor and to ensure that the treatment plan that we have put together for you is realistic. Um, I see that your medication, he increased the doses of your medication. So,
Excuse me.
that's okay. One of the things that we could suggest is that you make sure that you're adhering to the medication that has been prescribed to you. Um, and to take the medications at the appropriate time, because that can also be something that helps to in your medication management, and make sure that you're doing great with your medication. And also, I want to encourage that maybe you could keep a journal, and that journal can make sure that you're on task, understanding that your intake should be somewhere around no more than 3 drinks per day, and no more than 7 drinks per week, as according to the reference card. Is that something that you think is doable?
Yes.
Okay, sounds great. Do you have any questions for me at this time, Ms. Bennett?
Um.
Take your time.
No. Not this time.
Okay. Well, once again, I'd like to thank you for taking time to speak with me. I look forward to seeing you in about 4 weeks when you come in to meet with your primary care physician. And let's see if there is any way that
Excuse me.
that's
Ooh.
okay. We can work together so you can meet your treatment goals. Okay?
Okay.
Thank you so much and enjoy the rest of your day.
Thank you. Do the
Feel free to
same.
call if you have any questions or concerns in the meantime, okay?
Okay. Will do.
Would it be okay if I call you in about 2 weeks just to touch base with you and see how things are going?
That'll be fine.
Okay, sounds good. Thank you, Ms. Bennett. Enjoy your day.
Thank you. Do the same.
Okay.